Welcome to Under the Hood.
I'm Dr. Alex DeGrotto, your pelvic floor physical therapist.
And I'm Dr. Rebecca Howard-Udy, your sex and relationship therapist.
Hello. Hi, I've been practicing this term because I keep getting it wrong. So this is a term that actually comes up quite frequently in my clinic, but I didn't realize that there was an official term for it. And thankfully, Dr. Rebecca is all over this. And this is arousal non-concordance.
Mm-hmm. It's a big term.
It's a big fancy term. And can you tell us what it is?
Yeah, absolutely. So this is like the clinical sex therapy term for when the desire, which desire is wanting something that you don't have.
Mm-hmm.
And, we can have desire for all kinds of things, but in sex therapy, we mostly talk about desire for sex.
Yep.
And so being desirous of having a sexual encounter is desire. And arousal is the body's physical response to sexual desire, to a sexual interaction. So erection, lubrication, those are physical signs of arousal.
Blood flow, yeah.
Blood flow, exactly. And so when we have arousal non-concordance, which is extremely common.
Yes, it is.
What that means is that the desire and the arousal are not in alignment with each other. So when desire and arousal are in alignment with each other, we have desire for the sexual interaction that we're having, and our bodies respond with the appropriate arousal. I'm using appropriate sort of in quotation marks, but what we would deem to be the appropriate physical arousal.
Yeah.
Which our partner, if we're having partnered sex, would look at and say, oh, they're aroused. So for someone with a penis, that would be an erection. For someone with a vulva, it might be, increased lubrication, increased blood flow to the area, increased sensitivity.
Yeah.
And so when arousal non-concordance happens, what that means is that you could be very desirous of having a sexual encounter with your partner or solo, and the actual physical arousal, the symptoms of physical arousal are not showing
matching
up.
It up. So it's physiological. Yeah, that's so interesting.
Exactly. Because the physiological symptoms of arousal are separate from desire. These are two different things. And another place that this comes up a lot is it can go the other way as well, is that someone who is non-consenting in a sexual interaction can have arousal. So they may have an erection, they may have an orgasm, even during a rape or
that's so confusing.
A sexual assault. It's so confusing, and it can cause a lot of shame. But it is actually the body's way of protecting itself. It's the
physiological, like
physiological,
we said.
Exactly. So the arousal is not under our conscious control. That's the body's response. And so it's perfectly reasonable that these two do not always go together. And so it can be deeply confusing.
Oh, yeah, absolutely.
Either for someone who is the survivor of a sexual assault or for somebody who is really wanting to be sexual with their partner and they're struggling to achieve or maintain an erection, or, which is often the case where, adding a lubricant is really necessary because your body is not lubricating in the way that might make it comfortable to have any sort of penetrative intercourse or anything like that.
Wow. The examples that are coming to mind for me that a lot of people I found don't actually know is early postpartum, where your estrogen levels are suppressed and you don't lubricate, and you really need to use a high quality lube. And people don't realize that. And sometimes people's partners will get offended or be confused. And it's such a fraught time anyway with the changes in the relationship, especially first time, that people's feelings can get hurt, even though it actually has nothing to do with the desire. Like you said, it's just the fact that our body physiologically isn't producing as much lubrication naturally because of especially for people that are pumping or breastfeeding, their estrogen levels are suppressed. They haven't gotten a period back yet, all of those things. And that's mirrored again in menopause and postmenopause.
Yeah, absolutely. And adding a lubricant can be really helpful as well because, adding that lubricant can actually help with the physiological
Right.
arousal.
Yeah.
Because obviously, if you're trying to have intercourse and there's not enough lubrication, that
turn
doesn't
off.
feel, and it can be really painful,
Yes.
which then suppresses arousal.
Absolutely.
And so adding that lubricant, even though it's not the body's natural lubricant, we just have to, accept, okay, this is part of the way that our sex goes, and there's nothing wrong with that. And actually, it can really help with the arousal.
Yes.
Because it's like sort of the lubrication begets lubrication, because it then ends up making it feel better.
Yeah. And also, it would be important for the person's partner to understand that it really doesn't have anything to do with the desire or their attraction to them or their ability to turn you on. It's not about that.
No, it's not about that. Not at all.
But I don't think that's really well understood or well known.
No, I don't think it is either. And so it can feel really confusing to the partner, and it can feel really confusing to the individual.
So true, because I keep thinking about the partner, but even the person who's experiencing it within their own body might not recognize or know or understand the physiological processes at play. Whereas we, this before, when you explained to me what this arousal non-concordance meant, it was so clear. Oh yeah, I deal with this all the time in the clinic.
All the time. Yeah.
And I just didn't realize this term, but it's one of those things that I talk and educate so many patients about, and people of all gender expressions experience it. It's not just lubrication in the vagina. We're also talking about erections.
Yes, absolutely. Yeah. And so you can have a person with a penis who is deeply desirous of their partner, who is feeling really desirous of having a sexual encounter, can actually be feeling mentally turned on.
Yeah.
And their erection is not as hard or as consistent as they might like it to be. That can be caused by all kinds of different physiological and emotional things, but the two are not they're not connected all the time.
And so this really plays into our recent episode on talking about sex and talking during sex, is having a vulnerable and honest conversation about what's going on, especially for whichever partner understands a little bit more about the physiological aspects at play, that they can explain to their partner, actually, this truly has nothing to do with my desire for you. I am incredibly desirous of you. This is because of X, Y, and Z, if they happen to know the physiological reason behind it. But also, I think it really plays into expanding our view on what's possible with intimacy.
Absolutely. Right. And so I think it's so wonderful the way that you talk to a lot of your patients in the clinic who are struggling with these sorts of issues, about making a plan, about open communication.
Yeah, tools in the toolbox, and saying, hey, I'm going through this period of time that I'm experiencing this. Let's get the slippery stuff. Let's get the uber lube. Let's get, when this happens, I'm going to focus on pleasuring you. And that will naturally lead to, my arousal further on in the experience. Or we'll take our attention off of this part of our body and focus on kissing, focus on cuddling. I'll give you a massage. That's my plan for when this happens. So then it takes the pressure off.
It does take the pressure off. And what it also does is reduces the anxiety of what is going to happen when I get into this situation. How is my partner going to react? How is this going to go between us from a relational standpoint? And anxiety shuts down arousal.
Right.
So if we can lower the anxiety, normalize, this is something that happens to people all the time. This is really, really normal. And it often lands with the partner as, are you not attracted to me?
Yeah.
Do you not want to be with me? It causes
insecure.
A lot of insecurity, both in the individual who's experiencing it and also in the partner. And so lowering that anxiety, normalizing it, making a plan can really help with that.
Wow. I think this is so great. And also expanding the repertoire, having the tools in the toolbox. And I do feel that in terms of arousal, as we age, especially, there's some time at play. There needs to be a little bit more time. Whereas sometimes people are used to things happening quickly. And so now it's sort of more of that lead up time and more of that kind of remind me what you call it when you have people do that sensate focus.
Yeah.
Yeah.
We
Okay.
could talk about that another time. For sure, that's a really good sex therapy technique that can really help to reduce anxiety, to increase pleasure, to have, increased communication, all of the things that go into having a satisfying and overall connecting sexual experience. Because that's one of the things that's the most important, the connection.
Absolutely.
And so another thing that's really important to pay attention to is consent.
Yes.
So being consenting, of course, if we're talking a non-consensual situation, then that's different, right? The body may respond because arousal is not under our conscious control. It's not something that we can control whether it happens or not. So that may happen even in a non-consenting situation. But in a consensual sexual situation, in the context of a relationship, in the context of a wanted partnered sexual experience, it's really important to know and to trust your partner's consent.
Yeah.
So if they are, say, if a person with a penis does lose their erection, their partner asking, "Are you okay? Do you want to continue?" That's perfectly fine. That's checking in on consent.
Yeah, totally.
If it seems like your partner is wanting to be in the interaction, but arousal is taking a little bit of time, you're noticing that things feel a little bit different, checking in. Are you okay? Is there something on your mind? It's okay to ask, "Are you attracted to me? Are you?" But that's anxiety.
Yeah, right.
That's anxiety coming into play. As opposed to really just checking in on that consent. And also the individual when they become aware of it, right? So someone who has a penis, if they are aware that they may sometimes lose an erection, or the hardness of their erection may fluctuate over the course of a sexual encounter, or for somebody who's postpartum or going through perimenopause, or they just know their body and they know that they need to add lubrication ahead of time, saying this, like we just talked about, this could happen. It doesn't mean that I don't want to be here. I do want to be here. I am attracted to you. And so just really reiterating that consent can be incredibly helpful to keep both people connected, even when our bodies don't show up exactly as we might like them to.
This is reminding me a lot of people with vaginismus, which we have talked about, and that is that involuntary muscle spasm that almost just shuts the whole thing down and pushes it out. And so I do feel that for folks who are experiencing that, it can feel really personal, for the partner, and it's so wonderful to have this language that it's physiological and it truly isn't something that they're doing on purpose. And so that, I think, is even incredibly valuable for those folks as well, to understand that this isn't anything to do necessarily with the partner at hand, and everything to do with the vaginismus itself and working through that.
Yeah, absolutely. And for folks with vaginismus, there's all kinds of different techniques and ways to be sexual without having intercourse.
Yes.
When those muscle spasms shut down the vagina, it makes it really impossible a lot of times for anything to be able to be inserted, even something like a tampon.
Yeah.
Slowing it down, focusing on regulation, focusing
Absolutely.
on sensation. It doesn't mean that they're not consenting of being in the situation. It may mean that. They may say, "I need to take a break."
Totally.
And that's also fine.
Yeah, and I love that yes, no, maybe list. Sometimes for my people with vaginismus, we're doing dilator training and other things on the side, but we'll put on the no list penetrative intercourse for now. No for the now. Because
if it hurts, then it should be a no.
And pain begets pain,
Yeah,
so we're not trying to
absolutely.
perpetuate that pain cycle. But that doesn't mean you can't be intimate.
Yeah, that's right.
So I do feel that and it really expands the repertoire for people, which is wonderful.
Yeah. And I think similarly for people who are struggling with like an erectile dysfunction situation, intercourse where there's penis being inserted in, vagina or anus or whatever, that the intercourse may be on the no list as well, for just pure physiological reasons. But that doesn't mean that being sexual is on the no list. There's many, many, many other things that, like you said, expanding the repertoire can be, really help people to stay connected, to have other options where they can be there with their partner.
It can feel so satisfying too.
Yeah, it can feel so satisfying. But part of that is destigmatizing, understanding that this is normal, that it's okay, that it doesn't mean something other than just your body's physiological arousal is just not cooperating at the moment. And isn't that so often the case? I mean, our bodies refuse to cooperate in all kinds of things all the time.
Yes.
And so somehow we sort of panic when it's a sexual situation.
Because it is so vulnerable.
Because it's so vulnerable. But there's many times that our bodies, we have more fatigue than we'd like, or we, we have to say, oh, I'm not going to do that today. Being realistic about where we're at and what our body wants or doesn't want, without it being a crisis or, a bigger meaning.
And yes, exactly like you said, personal to the other person. No, it's the desire is separate from the arousal.
Completely separate.
Thank you so much.
Thank you.
Thank you for listening to Under the Hood. If you liked this episode, please take a minute and leave us a review. And we'd love to hear from you. If you have any ideas for future episodes, please let us know.